These are calcium crystals in the knees. Yes, you heard it right. Have you ever heard of a condition of calcium crystals in the knees? Gout and pseudogout are the two most common crystal-induced arthropathies. So, how do you know if you have a gout or pseudogout? What causes pseudogout to flare up? In this video, I will help you find answers to these types of common questions. Welcome esteemed viewers to an in-depth exploration of pseudogout, an intriguing and medically significant form of arthritis. Pseudogout is a condition characterized by the deposition of calcium pyrophosphate crystals within the joints, leading to acute episodes of joint inflammation and pain. In this video, I will discuss the complexities surrounding pseudogout, shedding light on its pathophysiology, clinical manifestations, differential diagnosis, and cutting-edge advances in diagnosis and the management. Calcium pyrophosphate deposition, that is CPPD disease, is a complex condition that affects the joints and causes significant discomfort and impairment. What is CPPD disease and how is it different from gout? Calcium pyrophosphate deposition disease is commonly known as CPPD disease. It is a type of rheumatological condition characterized by the accumulation of calcium pyrophosphate crystals in the joints. These crystals, which are formed due to an imbalance in calcium metabolism, can trigger a cascade of inflammatory reactions within the affected joints, leading to pain, swelling, and joint dysfunctions. CPP disease is also known by other names including pseudogout or pyrophosphate arthropathy, whereas gout is caused by monosodium urate monohydrate crystals. Pseudogout is caused by calcium pyrophosphate crystals and is more accurately termed calcium pyrophosphate disease. Both the condition, gout and pseudogout, are a form of arthritis that causes sudden and extremely painful attacks in one or more joints of the body. Gout often affects the big toe first, along with the elbow, wrist, finger joints. Pseudogout, on the other hand, generally affects larger joints such as knee or wrist joints. During both these conditions, sharp crystals form in the joints, causing irritation, swelling, redness, and pain. However, gout and pseudogout have different causes. For the sake of better understanding, we will discuss gout in some other video and we will focus on CPPD disease here. Causes and risk factors of CPPD. Several factors contribute to its development. Genetic predisposition plays a significant role as the specific gene mutations have been associated with disruptive calcium metabolism, promoting the formation of calcium pyrophosphate crystals. Increased adenosine triphosphate breakdown with the resultant increase in organic pyrophosphate in the joints result from aging, genetic factors, or both. Changes in the cartilage matrix may play an important role in promoting CPPD depositions. Overactivity of enzymes that break down triphosphate such as nucleoside triphosphate pyrophosphohydrolase has been observed in the cartilage of patients with CPPD disease. Therefore, inorganic pyrophosphate can bind calcium, leading to CPPD depositions in the cartilage and synovium. Hyaline cartilage is affected most commonly, but fibrocartilage such as the meniscal cartilage of the knee can also be involved. Additionally, advancing age is the prominent risk factors, with CPPD disease being more prevalent in individuals over the age of 60 years. Other contributing factors include underlying metabolic disorders such as hypothyroidism, hyperparathyroidism, certain medical conditions like osteoarthritis, and even joint trauma or surgery. Some medications can also increase your uric acid levels and the risk of gout, including diuretics, high blood pressure medications, blood thinners, chemotherapy medications, and cyclosporine are medications given to the patient after an organ transplant. Signs and symptoms. CPPD disease can affect various joints in the body, but it most commonly involves the knees, wrists, shoulders, and ankles. The signs and symptoms experienced by the individual with CPPD disease may vary in intensity and frequency. During acute attacks, which can last from a few days to several weeks, individuals often experience sudden and severe joint pain, accompanied by swelling, redness, stiffness, and limited range of motion. These attacks can reoccur intermittently with period of remission in between. Diagnosis. Accurately and timely diagnosis of CPPD disease is crucial to differentiate it from other joint conditions and initiate appropriate management strategies. Healthcare professionals employ a comprehensive approach to a diagnosis, which includes through a physical examination, a review of the individual medical history, and utilization of various diagnostic tests. Arthrocentesis. A key diagnostic tool is joint fluid analysis, in which synovial fluid is aspirated from the affected joint and examined under a microscope. It is found to be having a presence of calcium pyrophosphate crystals. Furthermore, imaging techniques such as X-rays and ultrasound play a vital role in diagnostic process, revealing characteristic findings such as calcifications within the joints and cartilage damage. Management options. Several management strategies are available to alleviate the symptoms, improve the joint function, and enhance the overall quality of life for individuals affected by this condition. The treatment approach is individualized, considering the severity of the symptoms and the impact of daily life. Let's explore some of the key management options. But before proceeding further, I would like you to remind that if you have found this video informative or helps deepens your medical knowledge and gain valuable insights, then do like, subscribe now, and activate the notification bell for more such insightful medical knowledge videos in the future. Medications. Non-steroidal anti-inflammatory drugs, NSAIDs. These medications are commonly prescribed to reduce pain and inflammation during the acute attacks of CPPD disease. Colchicine. This medication, often used for both acute and prophylactic treatment, can help you reduce the frequency and severity of the attacks. Corticosteroid. In cases of severe pain and inflammation, corticosteroids may be injected directly into the affected joint to provide relief. Disease-modifying anti-rheumatic drugs, DMARDs. In some instances, healthcare professionals may prescribe DMARDs to suppress the inflammatory response and prevent further joint damage. Lifestyle modifications. Exercise. Regular physical activity, including specific exercises aimed at improving joint range of motion and strength, can help maintain joint function and reduce stiffness. Weight management. Maintaining a healthy weight is very crucial, as excess weight places additional stress on the joints. By achieving and maintaining a healthy weight, individuals can reduce the burden on their joints and minimize the symptoms. Heat and cold therapy. Applying heat or cold packs to affected joints can provide temporary relief, reducing the pain and inflammation. Assistive devices. Splints or braces. These devices can provide support and stability to affected joints, alleviating pain and enhancing mobility. Canes or walkers. In cases where joint involvement significantly affects the mobility, healthcare professionals may recommend assisted devices to reduce joint stress during the walking. Surgical options. While surgical intervention is not typically the first line of treatment for CPPD disease, in severe cases where joint damage is extensive and conservative measures have proven ineffective, joint replacement surgeries may be considered. Joint replacement surgery involves replacing the damaged joint with a prosthetic joint to restore functions and alleviate pain. Preventive measures. While CPPD disease cannot be completely prevented, individuals can adopt certain measures to manage the condition and reduce the risk of flare-ups. Here are some preventive measures worth considering. Staying hydrated. Drinking an adequate amount of fluid can help prevent crystal formation within the joints. Dietary changes. Limiting the consumption of purine-rich foods such as red meat and shellfish may be beneficial, as purines can contribute to the crystal formation. Consulting a healthcare professional or registered dietitian can provide valuable guidance in developing a suitable dietary plan. Regular follow-up. Maintaining regular appointment with a healthcare professional ensures ongoing monitoring of the condition's progression and adjustment of the treatment strategies as needed. Lifestyle modification. Making positive lifestyle choices such as reducing alcohol consumption, quitting smoking, and having a positive impact on overall health. That's all about calcium pyrophosphate deposition disease, CPPD disease. I have tried it explaining as briefly as I could CPPD and its causes, signs and symptoms, diagnostic approach, and management options. Armed with this comprehensive understanding, individuals affected by CPPD disease can actively participate in their care, seek appropriate medical attention, and make informed decisions regarding their treatment journey. If you have found this video informative and insightful, please show your support by giving it a thumbs up and sharing it with others who may benefit from this. Don't forget to subscribe to the channel for future enlightening content. Take care, stay curious, and until next time, may your joints be healthy and pain-free. Thank you for watching.